Welcome into Queen City News Plus. I'm Kanady. We're at a place where most parents and kids probably don't want to spend their summers, and that's the doctor's office. We're at Novant Health Pediatrics in Concord talking about how to steer clear of summer sickness, especially one illness that's on the rise. So we are talking with Jakia Ranson, a nurse practitioner here at Novant Health in Concord. And you guys are seeing an increase in strep throat cases. How bad is it?
We've definitely seen an increase in strep throat the last few weeks, especially with school getting out. Definitely noticed that kids are coming in with the throat pain, and so we have to treat strep throat with antibiotics.
Okay. And in terms of the increase, would you say it's a lot higher than it was this time last year?
I would definitely say that it's definitely higher. I think that's probably because we are more out and about this summer than we probably were last summer. Definitely with COVID not being in place or those restrictions being more lenient, I would definitely say that there has been an uptick in cases.
Yeah. And is it odd to see this in the summer, strep throat?
Um, I wouldn't say that it's too odd, but we've definitely seen a few more cases with gatherings, out in the community with your families. We definitely have camps going on. We know that there are more kids in camp this summer. And, with our kids being in camp, they're going to share cups and different things like that. So we just expect this or have seen an increase in cases.
Yeah. Is this something that you see strep throat throughout the year? Is it kind of common or more common during maybe flu and cold season?
I would say that it's probably more common during flu and cold season. So definitely to see it in the summer, it is probably rare.
Yeah. In terms of the symptoms, I thought it was interesting because it's not always a sore throat, right? Let's talk about those.
Yeah, it's definitely not always a sore throat. So we're looking for other things like abdominal pain, nausea and vomiting. You may also notice that your child has a decreased appetite. So those are some other symptoms to look for.
Okay. And it can't get better, I guess, on its own. Is that correct?
Correct. It doesn't get better on its own. It may get worse. And so that's why you definitely want to bring your child in if they don't improve after a few days of having those symptoms, especially if it's a fever, worsening abdominal pain, or nausea and vomiting. Those are definitely things that you want to bring your child in for.
What's kind of the threshold for fever that you should really look out for and be concerned about?
Definitely, if the temperature is over 100.4, that's definitely considered a true fever. But if your child's fever is not being controlled with Tylenol or Motrin after the 3 or 4 days of treatment at home, then you definitely want to bring them in.
And any other symptoms to kind of look out for with strep?
The worsening throat pain, if they're having abdominal pain that isn't treated with home care, especially if you've called the doctor's office and, just what you're doing at home isn't improving, then those would definitely be some signs to bring them in.
And we hear about tonsillitis too. So what's the difference between strep and tonsillitis?
So tonsillitis is more of a viral illness versus strep throat, which is a bacterial infection. Tonsillitis can be treated with home care, so warm liquids, pain control with Tylenol or Motrin, versus strep throat, which is a bacterial infection that needs to be treated with antibiotics. And so in that instance, we would need to bring them in so that we could rule out the strep throat with a swab and a physical exam. And so in that instance, we would need to see you in the office. So if their symptoms continue to get worse, we would recommend that you bring them in so that we could rule out tonsillitis versus strep throat.
I'm guessing there's really no way to tell the difference.
Right.
They're similar.
Bring them in.
Yeah.
Yes, very similar. But usually with strep throat, you have the worsening difficulty swallowing, you have a decrease in appetite. Usually with tonsillitis, you're not going to have a fever. And so those are some kind of red flags, or what some providers like to say pink flags, that stick out to you when your child is having those symptoms that make you want to bring them into the office. That is different than tonsillitis.
And really is a strep test, the swab of the throat, that's the only way to know for sure.
Right, right. And even with tonsillitis, you can have some of the what we call white patches on the throat. You can have that with tonsillitis. And so you can have the same with strep, but then you need that strep test to kind of show you whether or not you're just dealing with the throat pain, or, having pharyngitis or sore throat versus the bacterial infection of strep.
So when is a good time to know if a child should have their tonsils or adenoids removed?
If they were continuing to have a lot of tonsillitis, or if they have chronic issues with having strep throat, that would be a time to follow up with your child's pediatrician to request that referral to the ear, nose, and throat provider, so that you can have that consultation for a removal, or just to have that conversation. Is now the time to have the conversation of needing them to be removed. So if your child is having that chronic condition of, they're constantly having a sore throat, or they're constantly dealing with tonsillitis, that would be the time to have that discussion of, do I need the referral to the ENT?
How contagious is strep? I know, if you have more than one kid and, passing it on, I mean, how is that an issue?
Yes. Strep can be very contagious, especially if your child is having a fever. Strep is also spread through droplets in the air. So that makes it, very passable when we're in the environment or just outside. So in that instance, if you're having a fever or if you're coughing, then we're all susceptible to passing strep to someone else. So that's the reason for us having to get on the antibiotics and, starting that treatment as soon as possible. So in that instance, if you have home exposure, then more than likely that child is at risk, that next child is at risk of, coming in contact with strep. So that's why, we let the parents know during that visit that, if that next child is starting to exhibit symptoms, definitely follow up with us and let us know so we can go ahead and treat them. And then if the parent comes down with the same symptoms, we let them know, go ahead and follow up with your provider as well. Because if strep isn't caught in its early stages or treated in a timely manner, then it can definitely lead to additional complications.
Yeah, I was wondering about ear infections. Can it also lead to that, other types of infections?
It can lead to other types of infections, but it more leads to an infection that can have a complication with the heart, which is rheumatic fever. And so that's why we want to go ahead and treat strep as quickly as possible, so that the child doesn't have an infection that can affect the muscle of the heart.
And let's talk about other illnesses. You said flu, COVID, RSV, not seeing a lot of those. What else are you seeing though here?
So we're still seeing the typical summer cold. So that's just your viral illness, cough, cold, congestion, with still comes with a fever for a couple days. Your child is still somewhat sluggish, maybe not eating the best. You would still treat that with your home remedies, additional fluids, cool mist humidifier. We're also seeing a lot of bug bites. So you definitely want to make sure that you're using your insect repellent sprays that are available in your local stores and pharmacies. We're also seeing a lot of cases of hand, foot, and mouth. Hand, foot, and mouth is presenting differently these days. And I think that's because of the warm weather. So the blisters are appearing differently. Some parents may mistake it for bug bites, but then when the blisters form on the hands, the feet, and inside the mouth, then that's when you know that it's hand, foot, and mouth So those are the other things that we've been seeing lately as well. And then it's still your typical stomach aches, and things like that because kids are outside, we're having those cookouts. So those cold foods are sitting out, in warm temperatures for for long periods of time. And so then that leads to stomach aches. So those are still some things that we're seeing out in the community.
So hand, foot, and mouth, and especially if it's appearing to be possibly a bug bite, but it's not really, I know it's really contagious. So how can you know, as soon as possible to try and get treatment?
So there's not really a treatment for hand, foot, and mouth. It's more home care, so supportive care. You'll kind of know if there's been an exposure in your child's daycare, or just in the community that you've been in, that you've been exposed to hand, foot, and mouth. But really, you'll know where the blisters present themselves, as if it's hand, foot, and mouth, or if your child has had hand, foot, and mouth before. So just the appearance of the blisters themselves, they can be soft. They may look like a white head. They may be in a cluster. They're contagious if your child has a fever or if the blisters have popped and oozed. So if you do see those on your child's body, you just want to make sure that you keep those areas covered until the blisters burst. And, just provide supportive care. They can be a little itchy, so, you want to apply hydrocortisone cream if you need to, which is available over the counter or at the pharmacy. And then just provide comfort care with Tylenol or Motrin for pain, because those blisters in the mouth can be painful.
Let's talk about prevention, because kids are going to summer camps and daycares and that kind of thing. And that is, as you mentioned, how things can spread. So what can parents do, especially if they're going overnight, their kids are heading to an overnight camp? Anything that they should do differently or do in general, to protect themselves?
The best thing I would say for prevention of any kind of sickness would definitely be teaching your kids good hand hygiene. I think that's the key prevention in any illness. So whether you teach your kids how to use hand sanitizer or teaching them how to wash their hands with warm water and soap for at least a minute, that would be a good thing to help prevent any illnesses. And then when they return from outside, to teach them to do the same thing, or when before a mealtime. I think that would be a good prevention. And then just making sure that they're up to date on, the recommended vaccines. I think that would be a good thing for any kid.
So, and as you say that, we're talking flu season is going to be right around the corner. So, the yearly shots are recommended. Anything else to prepare kind of for that and for cold and flu season, because it'll be here before we know it?
I would just say, make sure that your child has their recommended flu vaccine, and all of their other childhood vaccines that are recommended, getting them ready for the school year. That's about it, and as, new recommendations come out from the American Academy of Pediatrics, just take it from that standpoint. If new COVID vaccines come out or recommendations come out for that, then, if that's recommended, then if you have additional questions or concerns, you can definitely reach out to your pediatrician, or, if they have triage available, that's definitely a question that you can direct to your office.
And in the cases of, if a child does come down with an illness, you guys do have after hours clinics. How does a parent know, okay, I need to go, I need to use this service?
Yeah, so you can definitely reach out to your pediatrician's office. Novant does have after hours available. We have 2 locations, one located at Poplar Tent, and then we also have a location at Carmel Road. The after hours is available for simple sick visits such as ear infections, rashes, simple things that can be treated in and out. If you have more serious concerns or more chronic conditions, we recommend that you follow up with your pediatrician. But if you have something simple, then we definitely recommend come visit our after hours clinic After hours is available Monday through Friday from 5 p.m. to 9 p.m. And then we're also available on the weekends for when your doctor's office isn't available, from 10 a.m. to 6 p.m. You want to come into after hours if your child is experiencing that stomach pain and you can't get into your doctor's office, but you know that they just ate something, doesn't really agree with their stomach. They've had a couple episodes of vomiting and, you know, it doesn't really require the emergency room, but you know that they have a sour stomach and you feel like they need to be seen right then. After hours would be the perfect place for you. If your child has a more severe case of stomach pain, where it's like the worst pain that they've ever experienced, then you definitely would want to take your child to the emergency room.
Anything else you want to add?
Yeah, I would definitely recommend that if your child is due for their well visit over the summer, to go ahead and follow up with your pediatrician to schedule that well visit, because we do get booked. And so if your child needs that visit, or if they need to get caught up on their vaccines, to go ahead and reach out to your pediatrician and schedule that well appointment so you can get the required things that you need so that your child doesn't fall behind, or that, you know, they don't have to sit out of school to get it done. Even if your child doesn't need any vaccines, it's always good to do that annual well visit so that you're still up to date with your child's wellness, their growth and development, and things of that nature. So I really think it's important that even if your child isn't due for any vaccines, that you're still following up with your pediatrician at least once a year, just to make sure that their growth and development is where it needs to be. And that if you have any additional questions or concerns, you can address it all right then with your pediatrician or provider.
All right. Well, thank you so much, Jakia Ranson, nurse practitioner. Thanks for joining us.
Thank you.
Queen City News Plus. Just search Queen City News on your smart TV's app store.